Enrollment in a first-in-the-nation federal health study into exposure from toxic chemicals known as PFAS in New Hampshire will close at the end of this month.
The Centers for Disease Control estimates tens of thousands of people were exposed to compounds for decades at the former Pease Air Force Base. The chemicals, which are in firefighting foam that leached into the drinking water supply, are at the center of the New Hampshire PFAS investigation. And as News Center Maine's Vivian Lee reports, data from the study will be key in finding answers about the chemical's long-term health effects.
For Andrea Amico, nagging questions about her family's health never leave her mind.
Not knowing the long-term health effects is really worrisome to me.
Back in 2014, she discovered that her husband, who worked at the Pease trade port, as well as two of her children in daycare, drank water laced with PFAS chemicals. Studies have linked the compounds to organ cancers, kidney issues, and developmental delays. Andrea and other moms fought for years to get a federal study to look into the long-term health effects.
So we can give more answers not only to our community, but to the growing number of communities across the country also facing this issue.
Enrollment for the Pease Health Study, which is being conducted by the Agency for Toxic Substances and Disease Registry, will close at the end of December. 1,000 adults and 350 children ages 4 to 17 who drank the water at the base between 2004 and 2014 are needed to participate, but only a little more than 60% of adults and 26% of children have signed up. Now, the study office is located in this business park right off of I-95 in Portsmouth, but it is not a walk-in clinic. Patients must call and schedule their blood screenings. Children will also have to undergo neurobehavioral assessments, and both patients and parents need to set aside about an hour to do their paperwork. Celeste Ledoux's 3 children, Zach, Rory, and Ranger, were exposed to PFAS while attending daycare at Pease between 2001 and 2011. In the 5th grade, Ranger was diagnosed with a high-grade brain tumor. He underwent radiation and chemotherapy, and the cancer is in remission. While there is a family history of brain cancer, all 3 of her children participated in the study.
We as a community have an opportunity to help answer the why for so many parents in the future.
Ledoux also made a video encouraging other families to do their part to help determine the science about potential health problems from PFAS exposure.
And not just cancers, but any of the other childhood diseases that we see. What else could that water have been triggering?
Data collected from patients in the Pease community will be combined with findings from 7 other test sites in military communities across the country. Final results of the study are expected to be released within the next 5 years. In Portsmouth, Vivian Lee, News Center, Maine.
Enrollment closes for the Pease Health Study on December 31st.
If you'd like more information on how to participate, you can call the Pease Health Study. The number is 603-846-6192. We also have more information on the study and PFAS on our website and mobile app.